That's what we call it. Let's talk UTI. So if everyone's talking about it, maybe the medical organizations will take it seriously, which it
Hmm.
absolutely needs to be taken.
Laura Preves Helgeson is the founder of Let's Talk UTI, formerly UTI Health Alliance. Her organization came about because of her own lifelong experience of UTIs. It's the only US-based patient advocacy organization shining a light on the issues associated with UTI while providing valuable insights, supporting research, and furthering education to drive meaningful change. Let's Talk UTI is one of the four organizations that make up our Alliance for Patient-Centered UTI Research, otherwise known as APUR. The Alliance comprises Live UTI Free, Let's Talk UTI, Chronic UTI Australia, and QTIC in the UK. I'm so glad we have a chance to chat today, so thank you for joining me.
Thank you so much for having me.
We got a lot of questions from the community, but I wanted to start with a little bit more about your background and how you came to start an organization in UTI advocacy.
Yeah, well, as you had mentioned in your introduction, I have had this for my entire life. So I started with infections at around age 2. That was a little bit pre-verbal for me, so I don't have exact memories of that. But, just to give you an idea of my background, I grew up in a family of classical musicians, and I became a professional bassoonist. So I played in orchestras a lot.
Wow.
And then I went on to become an ordained interfaith minister, and I worked a lot in treatment centers for alcohol and drug abuse with those clients and with their families. I worked with a course that I developed on forgiveness, and then I got too sick to work.
Hmm.
And so my UTIs had really taken over, and I ended up basically being in bed for about 6 years, or at least chained to the house. And during that time, I really searched and searched for a US representation of patients, and I couldn't
Hmm.
find anything. But I did find your organization, and connected with you, and you've been a great mentor to me, and we've been good friends for a few years now.
Hmm.
And I feel like that relationship helped me to decide to begin um, a couple of years ago with UTI Health Alliance.
It's been such a long journey for you. Do you remember what it was like when you were a child to have UTIs?
Um, when I was a very young child, age 2, 3, I don't remember much, but I do remember when hitting age 4 that I started having procedures, and the procedures were pretty horrific. And because I think of the trauma around those procedures, I do remember how I felt, which was
Hmm.
terrified. Um, I felt kind of lost. I felt terrified and lost, and kind of like I didn't know who to trust.
Hmm.
And, those feelings of distrust, mistrust in doctors in particular, they're still they're still there to some degree, but
Yeah.
I've been working on them. Yeah.
It's hard to let that go, even if it starts as an adult, because it's hard to find care. And so you never know if the
Yes.
next appointment will result in an outcome or if it will just be more of the same. So I can totally understand that.
Yeah. The care is so spotty, and when you're an early patient, maybe you don't have the information that your website provides and that our website provides, so
Hmm.
that you can go to the doctor's office with information, and that you can go and ask educated questions, because oftentimes the patients are far more educated than the doctors about what the current research is and the fact that UTI testing doesn't work and things like that.
Yeah.
Um, so I think that that's part of the reason why I started Let's Talk UTIs, from my own very long journey, 55 years.
Hmm.
No, it's actually 57 years now, um, with UTI. I just felt that the patients deserve to know
Hmm.
what what were myths, and what might help, and just getting the word out. I think if the patients know, then at least we can start a movement.
Yeah, I think it's necessary. Did you ever
Mhm.
get any insight into why your UTI started in the first place?
No, have never had insight into that. Um, it's just a mystery, and why mine has been so, chronic and so unable to be resolved is, a mystery to me.
Hmm.
And, I've tried to find answers around that. And I feel like I do understand it a little bit better. But um, as far as like the initial, I mean, maybe I was in diapers and I have no idea.
Hmm. I think
Yeah.
that's like that for a lot of people, and it's not doesn't even matter probably from a lot of perspectives why it began. But it can
Mhm.
be part of the journey to try to figure out the root cause.
Yes, that is part of the journey. And yet I don't know that researchers even know the answer to that. So
Yeah.
they're working hard to
Yeah.
do it. But um, we need more funding and we need more just really talented researchers to go into this field and, support to stay on track with what they're doing because they're doing great work. Just the answer, it's not a simple illness,
Yeah.
it's so complex. And that's the problem, I think, with education is that the complexity is not understood by
Hmm.
your GP or urologist. Um, so many patients are sent away with um, a negative test and told to go get psychological help or given
Hmm.
antidepressants because of the doctor doesn't have other tools, I guess, and maybe they're even disbelieving the patients, which makes the patients very, very mentally unwell because it's tough when you're suffering so much
Hmm.
and a physician doesn't really recognize what's going on and you're told you don't have an infection. So what is it if you're suffering so much?
Yeah, and
Yeah,
that's part of the issue is that if it's not an infection, it still has to be something. The symptoms have been
right.
caused by something, but patients are just left with no care at all in many circumstances. What has your experience of testing for UTI been like in the US?
Well, I think the US is really focused on what is considered the gold standard of UTI testing, which is the dipstick test. You pee in a cup, you do the dipstick test, and if doctors can't determine what's going on from the dipstick test in office, they'll send your urine off for culture.
Hmm.
And those tests have been found by research to be extremely not to be relied on. And
Hmm.
so the dipstick test can be, the numbers vary, but around 50% inaccurate. And then the midstream urine culture is not up to 90% inaccurate. So how is it possible that we're still using these tests to diagnose people with UTI? I think it's just like a tragedy in the community of people who are living with this condition because what are we to do if the testing
Hmm.
has not been updated for more than half a century? And there's a lot of work to do there. Yeah.
There is, and even though there has been some research into why those tests might fail, it doesn't seem to have reached the medical practice much. So patients are, like you said, are often the ones to take that kind of information to their clinicians. Have you found yourself in that situation before where you've had to try to educate a clinician about the limitations of testing?
Um, I don't know that I've had to educate about the limitations of testing so much. I've actually had some pretty good experiences,
Hmm.
except for when I was very, very young, bad experiences. Um, what I would say is it was very confusing to me because I tested positive for 4 decades.
Hmm.
That's like 40 years of testing positive. And then somehow I started around perimenopause, I started testing intermittently negative
Hmm.
and then consistently negative. And so that was very confusing to me because I had worsening symptoms
Hmm.
and, I had had them my whole life and tested positive. So what's going on here? And it took a lot of digging for me to find anything that would back up my experience with
Hmm.
the testing. So I think for patients, I have heard patients bring a lot of research to their physician, and sometimes, maybe not all the time, their physician feels a certain way and then fires the patient.
Right.
And again, mental health wise, that is not very helpful.
It's not.
Um, or also physical health. I mean, it's not helpful at all. And so you had asked the initial question, which was about,
Your experience with testing in the US, but in addition to that, have you found any other types of testing that have been helpful for you?
Yes, there are PCR tests, um, DNA tests, and next generation sequencing tests, and there are some others as well. But those tests are readily available in the United States,
Hmm.
and they're more sensitive to maybe slower growing bacteria. And they also come up with, any bacteria that might be resistant to a certain antibiotic. So you can kind of pare that down and figure out which antibiotic might actually help.
Hmm.
Those tests have been incredibly helpful to me, but it
Hmm.
took a very, very long time to find a doctor that would order those tests for me. And it really was up to me to find the information myself and bring it to my doctor. And then they said, okay. And at that point, I had a PCR test, and that was somewhat helpful, but still, those are very narrow, the
Hmm.
PCR tests. And so I ended up doing some other testing. And we have actually a testing page on our website, which will
Hmm.
link people to some of the tests that I've done. And those tests were just amazing in detecting bacteria that was not being detected on the regular gold standard type testing. And that changed my life because I was able to then um, get the care I needed, which was long
Hmm.
term full dose antibiotic support, which has been successful in the fact that I feel like I can function again,
Hmm.
which is really lovely. Um, but I don't feel well most of the time, and I have symptoms all day, every day.
Right.
And so, I'm not sure, for me at least, that antibiotics are the answer. I don't know what the answer really is, but I've tried a lot of different treatments, and I'm going to be trying another one next week. And it just seems like I feel like I'm getting to the end of the line of what's being offered
Hmm.
or what's available. Yeah.
Can you share more about some of the things you have tried?
Sure. Yeah. Well, I before seeking help from outside the United States, I tried all kinds of supplements and tinctures and acupuncture. Actually, acupuncture and homeopathy was really good for me in my
Hmm.
20s, and that seemed to really calm down a very desperate experience I was having where I was literally peeing blood.
Yeah.
Um, and so um, that really worked for me. I tried working with that practitioner again in my late 30s, and I did not have the same kind of help
Hmm.
from that. So, what I'm coming to learn is everybody's really different, and also everyone's disease phase is very different, so maybe needs to be treated
Hmm.
differently. I tried D-mannose, which I know is super helpful for some people, lots of cranberry products. Um, didn't find any help there, but I know some people do.
Hmm.
Um, and so that was kind of my experience before getting on these long-term high dose or full dose antibiotics. And that's when things started to change for the better.
Okay.
But even that has not been to my, you know, to my satisfaction of comfort in my life. I still have
Mm.
quite a lot of symptoms that affect the way I go about my day. And so I first initially heard about the Euroimmune vaccine, which I
Hmm.
know is available in Europe. And I reached out to a doctor in London and was able to try that vaccine, which is like a little spray bottle. It
Hmm.
tastes like fruit, kind of like Hawaiian punch, if
Yeah,
you
I think
know
it's
what that
supposed to be
is.
pineapple flavored.
Oh, yeah, it's kind of fruity. So tastes great. Um, and I think it addresses four of the most common bacteria that people have when they have UTI, but I didn't notice a difference with that. However, I have a friend who had recurrent UTI,
Hmm.
and she has had completely resolved
Oh,
symptoms because of the
amazing.
Euroimmune. So, not one size did not fit all.
Definitely
Everyone,
not.
this is a very individualized illness.
Hmm.
And unless I can really come up with a root cause, I think it will continue to be so. After doing the Euroimmune vaccine in a couple of really hard years, I reached out to a clinic in Tbilisi, Georgia, the
Hmm.
country of Georgia, and I was able to get a prescription for phage therapy. And phage therapy was a game changer for me. I got out of a lot of the sort of comorbid symptoms I was having, like anemia.
Hmm.
Um, and I was able to really have a very good few months, and but that was about it.
Okay.
Um, and then I tried it again, and again I had the same experience. But obviously, it was definitely doing something good,
Yeah.
but it still was not getting out whatever's going on with me.
Right.
So yeah.
How was the process accessing the phages from Georgia?
Yeah. So they have a great info email. It's the
Hmm.
Eliava Phage Therapy Center.
Hmm.
Um, and so I just reached out to them through that very responsive person on the other end. And I was able to ask a lot of questions. But what ultimately happened was they thought I should come to Georgia, which is a really big trip for somebody who's so
Yeah.
chronically ill and needs to, the frequency is really a problem. So they were able to have me send a testing sample to them via the mail or FedEx.
Hmm.
And then they were able to prescribe based on that. And then they shipped the phage over to me in the United States. And that's how that worked. It's kind of expensive,
Hmm.
especially the shipping process is very expensive. And the phage is not cheap either, but it really helped me out when things were not looking good. So that was good, but still
Yes.
not the answer.
Right. Are there
Yeah,
things
right.
that you tried that you regret trying?
Oh, absolutely. Um, so the first one is I didn't really have any say so in it because I was four, and that is
Right.
the bladder hydrodistension, where they place a catheter inside you and fill your bladder up. I think it's with water or saline, maybe, I don't
Hmm.
know. And they fill it up to kind of beyond stretching. It's very, very painful. And for me, that experience was really tough because I was four at that time, long ago. They didn't have kind of the considerations placed regarding doctor's visits now. So my mom was sent out of the room, and this procedure is now done under general anesthesia, and I
Hmm.
had no anesthesia. So it was just some old guy sticking something into me and experiencing a tremendous amount of pain, and
It's
that
awful.
set me up for a lifetime of trauma.
Yeah.
So, yeah.
Yeah, that's really
Other
awful.
ones I I regret. Uh, Urethral dilations might have given me a small relief. However, in order to get to that relief, you have to pee through a cut in your urethra. I had that done 5 times, and I would not recommend it.
Yeah.
But everybody is different, so that's what I regret. And bladder cocktails that are supposed to like numb your bladder
Mhm.
that can be instilled in you. I had the most horrific reaction to that experience. I only had one done, and I've never felt so much pain in my life. So, I mean, everyone's different. So maybe this helps someone. I
Hmm.
don't feel like I've heard about that very much in the community, but you never know. Also, gentamicin installations.
Hmm.
Gentamicin is a non-oral antibiotic, and the installations, because of my past trauma, were traumatic in themselves. So I did
Understandable.
that myself. Yeah. And so that was maybe slightly helpful for, getting the infection under control for a week or two.
Yeah.
And, and then I had to deal with, sort of the trauma of doing that to myself. So
It's a lot to
yeah.
go through. I think a lot of people would not even want to try to self-catheterize for that purpose, and especially with something that you've been through in the past like that.
hmm Yeah. A lot of urethral trauma for sure. Um, well, I was desperate. This illness is an illness of desperation.
Hmm.
We don't have good solutions or testing, so people become extremely desperate and they're willing to try things. And what I would say about that, just given what I would tell my younger self,
Hmm.
is if you're not sure, or if it sounds weird to you, if you have that feeling within you that you're not sure, take a beat.
Hmm.
You can always get back to your doctor and really think about it, research it, ask support groups about it. Because that's the part I didn't do enough of when I was younger. And that's why I ended up with all those procedures that were ultimately not helpful to me.
I think
Yeah.
that kind of fed in for both of us to starting an organization because it is
Hmm.
very difficult to find that information about procedures and the science and what research has been done. You mentioned that you are thinking about a new treatment or a different treatment in the near future. Can you talk more about that?
Yeah. My urologist has been suggesting this to me for a couple of years. It's called bladder fulguration.
Hmm.
And I finally broke down the last few weeks and said, okay, I'm going to try it because nothing else is working. And basically, what that is, as far as I know, is the process of sending an electric current with like a cautery loop through the damaged areas of your bladder
Hmm.
and therefore releasing some of that bacteria that's stuck within the cells. And so the hope is then the antibiotics can get to that bacteria and hopefully clear the infection. I've read some really positive things about this. Um, so I feel hopeful, and this
Hmm.
surgery for me is next week. So
It's very soon.
yeah, it's very soon. I have to travel quite a ways in the United States to get to my doctor, but it's well worth it because he's one of the best specialists around who deals with this kind of thing.
Hmm.
So there are only a few in the
Yeah.
US, and yeah, and I think that's true for everywhere actually.
Did you have to have a cystoscopy to be able to see if you're an eligible candidate for fulguration, or is it just they'll do that at the same time, assess it and do the treatment?
As far as I know, they will do it at the same time. I had a cystoscopy many years ago,
Hmm.
maybe like 6 or 7 years ago. Was my first one following, the urethral dilations. I was very scared. It took me several years to agree to it. It really ultimately didn't end up being that big of a deal, but my fear was pretty big. And that cystoscopy came out all clear, like everything was normal, which
Mm.
obviously it wasn't. But so since then, my new urologist doesn't he hasn't done a cystoscopy. That one was normal. So I do have an appointment the day before surgery. I don't know what that will hold, so we'll
Hmm.
see. Yeah.
I hope it goes really well. By the time we
Thank
publish
you.
this video, you probably will have be out the other side of that. So maybe we can do an update once you've recovered, and
I
I'm
love
sure
that. That would
people
be
would love to
wonderful.
hear. And
Yeah.
you've done a lot of research and you've looked into all of this. You talked about support groups. Do you have tips for other people who are trying to advocate for themselves or research things that they might be interested in doing?
Yeah, there are a few really good websites. Yours is fabulous. I feel like ours has some good information, especially within our blogs. And now we're starting to do some podcasts. Chronic UTI Australia has
Hmm.
fabulous information, and QTIC. These are all of our APURE partners, right?
Yeah.
Um, so, so there are some really good websites, but you just have to know to look for them. And then also, once you find those websites, you can start to do some research and maybe bring some of that to a doctor's appointment. I would say bring this much and not
Mhm.
this much
Yeah.
because you don't want to overwhelm your doctor. Um, but the support groups, there are a few on Facebook, and they are so helpful.
Hmm.
They're people who've been through it. They're people who've done a tremendous amount of research, who have different experiences with different doctors. They will tell you what their experiences are. They will answer questions. And, it was really the bladder fulguration Facebook group that basically nudged me to say yes to the
Hmm.
the upcoming surgery. So that's how helpful that was to me. Yeah.
It's amazing the way that the community supports each other and provides resources and hope, I suppose, by sharing their experiences. It can really help
Mhm.
to make decisions.
Yeah, absolutely. And you can ask any kind of questions. Like one kind of the question I asked yesterday was, what clothing will I need
Hmm.
afterward? And I got some great answers.
Yeah, those kinds of practical things are really, really
Yeah,
helpful when you're going for a
yeah,
procedure, and it helps you to feel calm about what will happen after. You've at least got that prepared, even if you don't
yes,
know how you're going to feel.
right, exactly. And actually, the answers helped me to feel calmer because it didn't
Hmm.
seem like it was too much of anything.
Yeah, that's always what you want
Yeah,
to hear.
yeah, exactly.
So, how has your organization, Let's Talk UTI, evolved over time?
Well, as we talked about at the beginning, I originally founded it in my in my bedroom while I was in desperate in a desperate state as UTI Health Alliance. I had absolutely no experience with starting a business. I am not a researcher. I'm not a medical professional. So it was just basically talking with you and some others and just starting, basically just starting. And things started to roll where I got the opportunity to speak some places and I could see that the community was needing something like this. And so as time went on, we were a sole proprietorship. And so my husband and I were funding that on our own. And it became obvious that that was not sustainable. So
Hmm.
we decided to transition into a nonprofit organization. And hopefully, this new business model will sustain this over a long period of time. It's brand new, it's about 6 or 7 weeks old. But the mission is pretty much the same. However, I feel like we've gotten a lot more clear on what exactly we do to fill the space.
Hmm.
Because your organization fills the space in a certain way with research and other patient-centered kinds of documentation and information. And Australia does things and QTIC does things, but I'm thinking, what can I do? I don't have this experience or these degrees. Well, basically, what I can do is talk about it
Hmm.
from a place of having lived it in my entire life. And I really don't mind talking about it. At first, it was terrifying, um, but it has helped me work through a lot of the trauma I experienced to just talk about it, get it out there, not hide it anymore. I hid it my entire life until
Hmm.
a little over 2 years ago. And yeah, so that's what we call it Let's Talk UTI. So if everyone's talking about it, maybe the medical organizations will take it seriously, which it
Hmm.
absolutely needs to be taken with the deepest regard for how serious it is. Um,
Yeah.
so that's my mission. Education.
Yeah, and I think talking about it is so important. Like you've relied on those kinds of conversations in choosing your own path for treatment. We've had an amazing response from the community about sharing their stories on video, which I don't think would have
Yes.
happened 4 or 5 years ago. There weren't as many people talking about it. People weren't as willing to share their stories. Now we have a whole list of people who are lining up to share their stories so that they can help other people get through the same experience. So it's been amazing to see that development in the community.
Yes, I agree with you. Even 2 years ago, when I started it in January of 2023. It was like pulling teeth to get any person to share their story, even if they could do it anonymously.
Hmm.
Um, and now I'm starting to see them roll in a little bit more frequently. So it's nice that you've seen that
Hmm.
progression as well. That means
Yeah.
the word's getting out, and we're going to start a tidal wave of change.
That's how it happens. It has to come from the patients. They're the ones who've been
Right.
pushing for this from the beginning with the organizations and the story shared and all the groups that have come up on Facebook. And we have influenced the way that research has happened in the last eight
Yes.
years. And I think that we can keep on doing that. And the resources that we provide as organizations have been helpful for people. And I know that you have resources on your website. Can you share a bit about those?
Yeah. Yeah. It's hard to share them with you because you have such amazing resources. We are in the early stages of development for our downloadable resources, but we
Hmm.
do have a you have choices sheet, which is basically like you don't have to say yes to everything the doctor is throwing at you. You do have a choice to say no. You do have a choice to think about it. And I think that's super important. If I
Very.
could have told myself that, I would have had a different experience.
Hmm.
We also have a preparing for your appointment worksheet. And I think that just helps you get your thoughts together. I know that I was so terrified to see your urologist after so many traumatic experiences
Hmm.
that basically, when I finally did go back to your urologist, I spent the entire time crying. And she was holding my hand, and my husband was sitting next to me, rubbing my back. But because I had him at that time, there was some words behind what was going on. And I
Hmm.
feel like these sheets that help you prepare for your appointment are your words if you can't say them or you're
Yeah.
too scared. Yeah.
So
So we
helpful.
also link to the Hearing Patient Voices survey done by Chronic UTI Australia,
Hmm.
which is just a wonderful a piece of information, like it's deep and meaningful. And then also your resource directory, which talks a lot about bringing things to your doctor's appointment, and you have a symptoms improvement kinds of with the testing versus the standard urine culture versus the NGS testing, which is pretty remarkable, the difference there.
Hmm.
But we have testing choices, we have a blog, and in the blog, which is becoming more and more diverse in its topics, but in there are a couple of articles about the mental health component of UTI.
Hmm.
And one of those articles is about UTI and suicidal ideation. So that is a problem. So,
Yeah.
yeah, patient stories. So there's a lot to look at. Yeah.
I think it's really important to cover the mental health side of things, and it is something that patients deal with, especially with not being believed with their own
Mhm.
experiences. And then if you can't be believed based on your symptoms, where do you turn from there? So it can feel very, very lonely.
Yeah. And I think the support groups really come in to help and hold people who are
Hmm.
feeling, alone and desperate. Yeah. But you're absolutely right. When you're told there's nothing wrong with you, and you know very well there is, um, it can be really devastating.
Yeah, it's hard to know who to trust, which I think is what you said earlier.
Yeah,
If you don't know who
exactly.
to trust, then what next step do you take? And that's where the community support groups can really
Mhm.
have your back.
Yeah, for sure.
So, where are you hoping to take Let's Talk UTI in the future?
Well, we have some wonderful kind of media opportunities that are starting to pop up, which to me is kind of the point of Let's Talk UTI, is to get out in front of large swaths of people, major news outlets, things like that, in order to make this very well recognized as an enormous problem.
Hmm.
So that's really an immediate goal, is just to be out in front of as many people as possible. And I feel like news media or magazines or whatever it is, or podcasts, doing this um, is one of those avenues. As far as like the far into the future, what I'd
Hmm.
like to see is meaningful change based on the fact that we, as patient groups and as patients, are doing something about this. That doctors will have to learn what is actually happening in research and what has been proven, so that they will doubt their old methods. And
Hmm.
the more that happens, I think the more there'll be some change.
Yeah, and you mentioned media opportunities, but we've been seeing a
Mhm.
lot in the media, especially from the US in recent times, about changes in research funding. We've received a number of messages from concerned community members about what that might mean for UTI research. Have you seen that landscape change already?
Oh, absolutely. With this new administration, I'll just give you an example. Two major research universities, Columbia University in New
Hmm.
York, lost $400 million in grant funding. That was a week or so ago. And just this past week, Johns Hopkins University, which is a major research university for medical things, lost $800 million in funding for grants. So that is just two of our universities, but this is
Hmm.
happening across the board. I've talked to scientists who have almost come to the end point where they know they're going to get funding for their research. And that funding is now stalled.
Hmm.
They don't know if it's going to get taken up again. Um, I think there's a lot of confusion happening right now.
Hmm.
And as far as UTI research is concerned, I mean, we were barely getting anything as far as funding in the first place. And now it seems that funding is just being cut left and right. So hopefully this is not going to affect what research has already been happening. Um, and certainly I feel like there are ways around it. Maybe people will become more privately interested if they do have some of their own resources. So we'll see what happens. It's a mystery.
Yeah, I think we'll find out soon about how some of this is
Hmm.
affected. We are also keeping our eye on it because it's not good news for the UTI community. And have
No.
you seen any new treatments on the horizon in the US?
Yeah, GlaxoSmithKline, GSK, is coming out with a new antibiotic, and you'll have to correct me if I'm wrong about the pronunciation. It's gepotidicin.
Gepotidacin, I think.
Gepotidacin.
Yeah.
Now I'm looking at it. That's right. Gepotidacin. Thank you so much. Um, that is coming to pre-market review at the end of
Hmm.
this month. And I don't really know how long it takes for that process, which is the FDA is basically making sure that it is safe to use. I don't know how long it takes from that process to actually coming on the market,
Hmm.
but that is on the horizon. And I
Great.
hope that helps a lot of people. I really do.
Have you heard stories from people in the US being able to access Euroimmune? We talked about that briefly earlier.
Mm,
If within the US, have you heard anything about that?
no. Um, I believe there is a lab in the US that it is looking at, accomplishing the hurdles that the US has to get things like Euroimmune on the
Hmm.
market. But at this point, I don't believe it's available in the US at all.
Okay.
Um, there was something about it being available in the like down in the Bahamas area or something like that. I can't remember exactly where, but I would say Europe is your best bet. And I know there's a Strovac vaccine as well,
Hmm.
if I'm pronouncing that
Yeah.
correctly. And I don't know anything about that, but I'd love to learn more.
We've mostly heard of people accessing that one in Germany. Maybe
Hmm.
it's where it's produced. And I was actually offered that myself when I lived in Germany, but the clinician wasn't very convinced that it would be helpful, which in turn led me to not be convinced that I should try it. So I never did. But I think we have heard from people who've tried that one and Eurovaxum too. But Euroimmune seems to be the one that people can access the most.
Yeah. Well, hopefully those kinds of things will happen here. I know that we have, I think, two other vaccines that are up and coming in the US, but I haven't heard much about them. Um, so, and with this current state of what's happening in the United States as far as research funding is concerned, I just don't know how new and up and coming treatments will be affected. Probably not in a good way.
Probably not. Do you think in the
Yeah.
future, as a nonprofit, you might raise funds for research, for specific research projects?
Yeah, I think that's absolutely possible. We are in I would call our infantry
Hmm.
stages, infancy, excuse me, infancy stages. And, right now it's just about getting the word out and, doing as much education as we can. But certainly what I've learned more than anything else in these past couple of years is that things change
Hmm.
and that we're constantly evolving and changing. So we'll see what happens.
How can people get in touch with you if they'd like to use some of your resources or to provide their own support for what you do?
Oh, thank you so much. They can get in touch on our website, lettalkuti.org. No apostrophe in
Hmm.
let's. And you can find the opportunities to donate there. And then they can sign up for our newsletter, which would be wonderful to be in more connection with the community. We also have an Instagram page at Let's Talk UTI and Facebook, Let's Talk UTI.
Great.
So, yeah, thank you.
If there's one thing that you wish that people knew about UTI, what would that be?
Did write this down. Um, I would say that they are a big deal. They're a really big deal. And depending on where you are in the disease phase, acute UTIs sometimes are completely wiped out by your first set of antibiotics and you're on your way. But that doesn't happen for a lot of people. Um,
Hmm.
so, um, so they're a big deal. Everyone needs to talk about them comfortably and without shame, and they need to be regarded very seriously in the medical setting. Sorry, that was three things.
Three things is perfect, and I couldn't agree more. Well, thank you so much again for sharing your time with us to answer these questions. And I really hope your treatment goes well and that we can do a catch up on the
Thank
other
you.
side.
Yes, absolutely. Thank you so much, Melissa.
Thanks so much for watching. I hope you found this expert video helpful. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveUTIfree.com for related articles. We'll drop some links in the video description. If you like what we're doing on this channel, you can support our work by hitting subscribe here on YouTube, and don't forget to tick the bell so you'll be notified of our future videos. Thanks again for watching, and until next time, keep asking questions and pushing for better solutions.